afternoon. I'm Nicole Truog with the Center for Financial Security, and welcome to today's webinar, Coming Up with Cash in a Pinch, Emergency Savings and Its Alternatives. This webinar is part of the Family and Financial Security webinar series sponsored by a grant from the UW-Madison School of Human Ecology Beckner Endowment. Our presenter today is J. Michael Collins, Faculty Director of the UW-Madison Center for Financial Security, and our discussants are Pamela Chan, Senior Policy Analyst at New America Foundation Asset Building Program, and Mae Watson-Grote, Founder and Executive Director of the Financial Clinic. A couple of quick housekeeping items for you before we get started. If you have any technical difficulties, please call 1-800-442-4614. To submit questions during the Q&A portion of the webinar, locate the dark gray bar near the top of Media Site, click on the Ask a Question icon, and a window will open. Please type your name, email address, and your question, and hit send. So with that, I'd like to turn things over to Michael Collins.
Great. Thank you, Nicole, and thanks, everybody, for being here today. Today we're going to talk about the working paper and brief that are on the Center for Financial Security website called Coming Up with Cash in a Pinch, Emergency Savings and Its Alternatives. This is a project that has been worked on over the last year or so by two colleagues of mine, Stephanie Chase and Leah Jertson, with support from the MDRC in New York City, the New America Foundation, and then the AutoSave project that MDRC has worked on with C.S. Mott Foundation and the Rockefeller Foundation. And we're grateful to all of them and their staff for their support of this project and for helping us both with the ideas and the work itself. Of course, all the opinions that I'll share today are my own, and those are my co-authors, and I'm sure that those who have supported our project would agree. So what this project is, or what this paper equivalent brief are, is essentially a literature review. And if you download the paper online, you'll find that half of the paper is a chart, a matrix of 80 different studies, or over 80 different studies that we reviewed. And these studies were on a range of different issues around asset building, emergency savings, alternative financial products, different kinds of tools and resources that people use when they need cash in a pinch. So it's a very broad set of literatures that we looked at, broad set of studies. We didn't do any new analysis ourselves. We just tried to analyze what was out there and summarize that for those of you who work in the asset building field and related fields to think about this issue of emergency savings. And I'll define a bit more how we think about emergency savings and why we think it's important to look at it on its own. But the goal of this project was really just to cover the landscape, to look at the waterfront, to pick your metaphor here, to understand what's out there and how it might inform this particular topic. We hope that this is useful for other researchers as they begin to do work around small dollar savings or uses of credit for short-term expenses, as well as how people handle income shocks and expenditure shocks. We also hope it's useful for practitioners who are creating programs, who are designing products for low-income people and other people, and thinking about the role of public policy, how we can encourage savings, how we can encourage people to responsibly use short-term liquidity mechanisms, including credit, and what are the effects of removing those options for people? What alternatives do they have when specific alternatives are taken away from them? So it's really a broad research initiative meant to, again, cover a wide swath of different areas and to help inform future research as well as to provide some insights for practitioners. I won't stand here today and say that we have found all the answers. We are simply trying to explore this topic and hopefully inspire others to think about these topics as well. So just defining terms a little bit as we move forward. The idea of emergency savings is one that you will not see very much in most of the economic and other asset building household financial literatures. We can think about emergency savings as being important for two specific reasons. One is you might have a drop in income. Say, for example, a household had two employed people and one of them loses their job and now their income has declined significantly. Or one employed person who had significant overtime hours and those overtime hours decrease. Or simply a cut in pay. All these might be drops in income. And when income drops and people still have the same kind of expenses, they have to pay for housing, they have to pay for food, they have to pay for transportation, those expenses probably don't drop enough to offset the drop in income, and then they have to tap into savings or find other forms of liquidity to pay for those expenses. The other important role of emergency savings for people is if they have an unexpected increase in expenses. So classic examples of this might be a car repair or a home repair or a health care emergency that has to be covered. These are all expenses which are difficult to insure. They're difficult to predict. While you might know at some point you might have to make a car repair, you might not know when or how much, and so that makes it difficult for people to anticipate and to calibrate their expectations for savings. Sometimes we think about emergency savings as being a rainy day fund. You can think about this in some way as a form of insurance. The rainy day fund is there just in case. Some event which has some perhaps small probability of happening could be expensive, and therefore we want to have money set aside for that. Sometimes these are very variable events, and so that makes it hard for people to predict. But essentially when we say liquid resource, we mean something a resource that somebody can tap in the short run. I have a bill due in a few days. How do I come up with $1,000? Or I have an expense that's coming due, or I've had a drop in income. How do I come up with some money in a relatively short amount of time? You could think about forms of liquidity which take longer to tap, say a home equity loan that might take you several weeks. Or you can think about ways to save money over time that perhaps you're preparing for a future event. But in general, when we say liquid, we mean resources that can be tapped quickly. Think about a checking account, perhaps a savings account, other kinds of fast and readily accessible forms of financial resources. Generally, when we talk about emergency savings, these are small amounts. I mean, they're not small to somebody who has a low income, but they're small relative to, say, retirement savings or education savings, where people may be saving tens of thousands of dollars over many years for an event that's going to happen in the distant future. Emergency savings is smaller amounts, typically 3 to 6 months of expenses, something in that order, or a couple of unexpected car repairs or home repairs. There is a pretty extensive literature in economics and related fields around what we call precautionary savings. Precautionary savings is a very important area of study, and one that I think has continued to be, in the current recessionary environment, one that many folks have been looking at and I think worthy of further research. But precautionary savings is a little different. Precautionary savings says that people who have variable income, whose income, say perhaps it comes from commissions, or perhaps they work in an industry where there's a cyclical, a cycle to when their income comes in. Think of somebody in construction, and there's not much work in winter, but a lot of work in summer. What precautionary savings suggests is that people who know that and can anticipate that their income could be up and down will, in fact, set up savings accounts to prepare for the lean times that might be ahead. So when times are good, they set money aside. When times are bad, they tap into that. And there is certainly some evidence that people in those sort of professions or in those labor markets do behave that way, although it explains a relatively small amount of total savings, and obviously you have to have some expectation set by past events to be able to get to that point. But precautionary savings, I would argue, is important but slightly different from what we're talking about today. We're also talking with these short-term emergency funds are also different from longer-term savings. So it's very different from saving for retirement or saving for education or even saving for something like a house, something that might take multiple years to save up for and is a big investment. Rather, we're thinking about relatively small amounts of money that can be tapped in the short run for a variety of everyday expenses or everyday needs. There's a table in the paper and also in the brief that summarizes a variety of what we call liquidity mechanisms. So you can think about these as the sources of short-term financial resources that people might be needing to tap. And the two that, of course, come to mind for most people are checking accounts and savings accounts. And in fact, for many people, that's where they keep their emergency fund, their rainy day fund. A small interest-bearing savings account or a non-interest-bearing checking account can be a mechanism that people can store money in. These accounts are generally not free these days. There are some expenses or some minimums that are required. And for some people, these accounts are either hard to access, they're something they're not comfortable with, they've had bad experiences with in the past, and in some cases, if they're not managed well, can be relatively expensive if you think about the kinds of fees that people may incur by not keeping a minimum balance or bouncing checks, those kinds of things. So not all consumers are equally happy with checking and savings as a form of liquidity, but obviously for a vast set of particularly middle and upper class people, that tends to be where their liquidity comes from, these sort of transactional accounts or savings accounts. There are a variety of alternatives that are out there. I'm not sure that people in the field always think about these as being complements or substitutes for emergency funds, but in many ways they are. So, for example, we know of people who have, and you probably may have happened to you yourself, where you run into a pinch, you need some money in the short run, so you turn to friends and family. That can be a source of, a parent or a sibling or somebody else who can help you get through a short-term expense, and then you pay them back, sometimes with interest, sometimes not. Although, if you've done these before, these are relation-based transactions, so oftentimes the interest can be non-monetary, other ways of collecting. These sorts of lending make a lot of sense, and particularly if you look at, in developing economies or even among vulnerable populations, this is a very important way that people are able to smooth spending and smooth income over time is by relying on friends and family for these short-term mechanisms. From a sort of theoretical perspective about how people lend and how lenders evaluate borrowers, it makes sense that friends and family might be pretty good at evaluating your ability to pay. They have access to a lot of information that a formal lender would not have available to them. So it can be a useful and important way that people can smooth these expenditure shocks and these income shocks over time. It's not been highly studied, particularly in the domestic context. It's probably been more widely studied in the international context. But there is some logic to this market existing and probably remains, for some populations, a very important source of liquidity for emergency funds. Another form of liquidity, and again, I probably a lot of people don't think about this as a form of liquidity for emergencies, is just skipping a payment. We see lots of examples among low-income populations where, particularly in the winter, in localities that have some protection against utility cutoffs, people will not pay a utility bill because they know that while they may have to pay a fee for missing that particular payment, freeing up that cash can help them make another bill. And they'll use that as a way to get by. So people think of ways of essentially borrowing from themselves, and the cost of that loan would be whatever that late fee is, whatever that particular charge might be. So skipping a payment, making payments late, these are all forms of cash flow management, which are actually quite sophisticated from a financial perspective, where people are weighing these costs and benefits and thinking about how to do these kinds of things. Now, obviously, not all missed payments are these strategic calculations. Sometimes people just forget. Sometimes they just have no intention of paying. But it is a mechanism that exists for some people that they can exercise to be able to try to smooth their spending over time. Another important source of liquidity for people, at least in localities where it's permitted, is a payday loan, a cash advance loan. These are loans where you typically have a checking account, but you are able to get an advance on a future payment from an employer, typically people are employed, for a relatively high cost. Sometimes the cost of these loans are $15 per $100 borrowed, $20 per $100 borrowed, which if you're in a pinch and you're facing, say, a $35 or $40 late fee, perhaps isn't relatively expensive. But if you do that every month, every paycheck, it can become quite expensive, and the APRs, if you were to annualize these, become quite high. Some places have banned these, or they've come up with limits on what these fees can be. Other places in the country, the payday loans are relatively widely available. People generally use these as a mechanism to bridge funding. So they need to get from period to period, and this is a way to advance money into the current period to make some expenses, to pay some expenses. Obviously, many people get into trouble with these loans. They continue to roll them over and over and over. But it's a tool that's out there. Some people use it. It's certainly very controversial. But it's important to understand why people use it, and that, in some ways, these are a symptom of the fact that people need liquidity, and these tools are something they use to do that. A related product is the pawn shop loan, probably one of the oldest products that's available. Dates back, to the Middle Ages, really, where what's important about a pawn shop loan and some of these other loans I'll talk about in a minute are that they have collateral behind them. So from a lending perspective, I'd much prefer to lend to you if I have something that I can take and sell to pay off the loan if you default. A payday loan, these other kinds of loans, they don't have that same security. So it is certainly has some advantages from a theoretical perspective of how a lender might approach a lending decision. Pawn shop loans have they've been quite popular over the ages. They continue to be popular among particularly vulnerable populations who have some tangible property that they can pawn in order to get short-term liquidity. Very similar to a pawn shop loan is an auto title loan, which again are not available in all localities. Some places have prohibited these types of loans. But an auto title loan is essentially a way to pawn your car. You can borrow some of the equity that might be available in the car. From a collateral perspective, from a lending perspective, it's pretty easy to repossess a car in the grand scheme of things, easier than some other products and goods. So this is a way that lenders have been able to efficiently offer credit. Very high cost. For people who are in these positions, it's oftentimes a loan of last resort. And the potential downside of losing a car, if you need a car for transportation to get income, are significant. So it is an important area to look at. Again, it's just one of those mechanisms that are out there that people have turned to. Another type of loan is the refund anticipation loan. These tend to occur, you start to see ads for these in November or so, where people are borrowing against their tax refund for the next year. In the last decade, these became extremely popular. We saw high rates of these being used. In the last couple of years, much less so due to both regulation and changes in the capital market. But essentially, people are anticipating future income in the form of a tax refund, and they're trying to speed that up so they can receive that more quickly, and they pay a significant fee for that. Again, I'm not here to debate whether these are good products or bad products, but people use them because they need liquidity in the short run. A common product that people use, particularly if they have better credit or have been involved in the credit market in the past, is a credit card. A credit card is probably the most common way for people who have regular income to smooth their spending over time, allowing credit to revolve for a short period of time in order to do that. Credit card loans can be very convenient. Revolving the credit often incurs some costs. The costs are highly variable, but if people do pay those off in a relatively short period of time, that can be a fairly efficient way to have an advance on credit. The issue with credit cards is that for populations who most need emergency savings, they oftentimes can't qualify for a credit card. So that form of credit isn't available for a large portion of the vulnerable population market that we might think important. A mechanism that we've seen much more use of in the last few years has been loans against a retirement account, against a 401k, or even just liquidating a 401k or retirement account. There's other forms of retirement accounts other than 401k, but 401k tends to be one of the more popular ones. These can have significant costs because there could be tax liability due. If you end up being separated from your position, these loans become due. So it is a very important area to watch, and there is some good research ongoing right now in this area. These tend to be more widely used among people who have retirement accounts, which tends to be people who are older, people who have higher incomes, not so much among vulnerable populations. The biggest danger or the biggest worry that we have about people who tap into their retirement funds for an emergency is that it deprives them of the potential use of that money in retirement unless it's repaid in a pretty good fashion. At the very least, it deprives them of any accumulation in that asset in terms of interest and principal. So it's an important product that is currently being used as a form of liquidity for some people, but again, not widely spread among vulnerable populations simply because they tend not to have access to that product. The last liquidity mechanism that we thought a bit about, and I think is of great interest and not widely studied, is life insurance, whole life or permanent life insurance policies that have accumulated some cash value which can be borrowed against. Again, there's a collateral there, so the life insurer is more willing to make these loans. What's important about whole life insurance or permanent life insurance policies is they, at least in the past, used to be quite popular among minorities and lower income populations. They were essentially sold door to door. We worry a lot from a consumer protection perspective about how they're sold and what kinds of fees were charged and those kinds of things. And that has unfortunately tarnished in some ways the reputation of the mechanisms that these products were sold through. But for somebody who has accumulated some cash value, it is a relatively cheap way to borrow against that collateral. The main cost would be if you were to pass away and your heirs had expenses that they were counting on that policy to take care of, that money wouldn't be available. But in cases where populations do have access to these they have built up cash value in their whole life insurance policies, it can be a way to have some liquidity available to them. So those are the large forms of liquidity that we could think about. This is a slide which I know is small for many of you to see, but this is a study that was done in 2009, the FINRA Financial Capability Study, where they asked people if they've had a drop in income in the last 12 months, and they asked them also if they have at least 3 months in emergency funds. So emergency funds was pretty broadly defined in the study. But I think this gives you a good sense, and I don't want to, focus too much on any particular aspect of this. But if you look at the very low-income people, the red bar, which is the people who've experienced a drop in income, is much bigger than the blue bar, which is those who have 3 months of savings. And then if you go to the highest income groups, it's completely flipped. So the trend here is that now, of course, people could be low-income because they had the drop in income, and they may have had to tap the assets, but which would give them a smaller 3 months cushion. But the main point here is that among people who are most likely to potentially experience a drop in income or maybe experience another drop in income, those liquidity mechanisms aren't there in terms of having an emergency fund, and so they end up having to tap into some other resources to do this. The next data, again, this is from the FINRA Financial Capability study as well, just shows bank account holding, both checking and savings accounts holdings by income. There have been lots of studies on the unbanked and underbanked and the prevalence of bank accounts among households. And this is just another way to cut it by income, showing that if we do believe that checking and savings accounts are a primary way of having a rainy day fund, they're just less prevalent as income levels go down. So it's an important consideration as we think about how people are going to accumulate assets over time. The next slide is of some data available from the Survey of Consumer Finances, which was tabulated by economists at the Federal Reserve Board. And it shows a variety of different kinds of financial assets and debts that different households have by their relative income level, income as a percentage of the median. And what's important about this is that even among low-income people, there are accounts available, different kinds of transaction accounts, different kinds of bonds, of life insurance, of debt products as well. So these products are relatively widespread. Now, obviously, the distribution varies over income levels, but these are the sort of the mechanisms that I described earlier are available, at least for some consumers, in each income segment. So the big question that I think this literature review poses is, why is it that people don't have emergency savings? Why is it that they have to tap alternative sources of the credit markets or otherwise in order to bridge when an income shock or an expenditure shock happens? One of the most common examples or most common explanations that we come across is that when most of your income is needed for consumption, and in consumption I mean housing, transportation, food, the basic needs that you have, if your income's relatively low, those could absorb almost everything that you have. That leaves very little left that could be put into a savings account, a checking account, or some alternative savings mechanism. So it just may be there's not enough slack available within somebody's budget to allow for that kind of consumption, that kind of savings. Another reason why people have been said not to have, particularly low-income people have said not to have emergency savings, is that they don't have a mechanism. They don't have access to a savings account, a checking account that's convenient for them, that's cost-effective for them to be able to get to, or other kinds of mechanisms. But they do have, say, a payday lender in their neighborhood, or they do have an auto title loan. So that may be an issue too. This whole idea of accessibility, of financial accessibility, a financial inclusion is an important area to think about. Not just are the products available, but are they accessible where people are at? Another important issue is that there are rules in programs that people participate in, whether they're public programs, insurance programs, other kinds of programs that people are involved in, that actually restrict the amount of assets that you can have. And particularly liquid assets are something that are looked at as people who have significant liquid assets can be declined or denied access to certain kinds of programs that might be supportive of public benefits and other kinds of programs that might be helpful to them. So to the extent that people recognize that, they might then limit their savings in order to not be restricted from getting access to these public programs. Another issue we came across was that there are legal issues that people may confront. So, for example, a garnishment or a judgment that may be levied against somebody. Even though, say, they may have income that's garnishment-proof, income that might be from a public program or another source, they still may be afraid to put any money in a bank account or checking account because that bank or institution could freeze the account because there's a judgment order against them. So these legal issues may incorrectly or correctly discourage people from taking part in any kind of formal savings products. Another important issue is simply behavioral failures. We probably are all guilty of this. We don't do what we know we should do. We procrastinate from dieting, we procrastinate from exercise, and we procrastinate from savings. We tend to be very focused on the present. We tend to overly discount events that could happen in the future, especially events where there's some variation in both the cost and the likelihood that it might happen. And so we have these basic behavioral failures, which people may say, yes, I want to build up a savings account. Yes, I want to have 6 months of emergency savings, but I'll do it tomorrow. Tomorrow comes, and they fail to do it. So these behavioral failures, I think, are an important aspect as well. When you combine the behavioral failures and the policy and regulatory issues and legal issues, the lack of products, and then not having enough resources in the first place, this makes it very hard for people to accumulate emergency savings. I think in general we need more study of this area of the emergency savings market and of some of the potential failures in the emergency savings market. I think there's some very interesting work being done in the behavioral finance area that suggests there might be ways to get people to overcome some of these behavioral failures and create more accessible, products that people are willing to, and eager to use. So I think there's some exciting area ahead in this. So thinking about implications for policy and for practice, I think if you're involved in a program or working with people, with clients who are engaged in programs where there is some sort of an asset test, where you actively look at bank account balances, certainly we are afraid of people who have high assets who have low incomes and then take advantage of some public program. But having 3 to 6 months of income set aside for an emergency shouldn't be something that we penalize people for, and in fact should be something that we encourage people for. So rather than some fixed benchmark of assets that we look at, try to find some more relative measures so that we can encourage people to have 3 to 6 months of savings available as an emergency fund without some kind of penalty and their ability to apply for other kinds of programs that help. Obviously, products are important. Having low-fee accounts that people are comfortable with, perhaps that have some constraints, so it's not really easy to get access to money. Perhaps I have to go to a bank or I have to do some special tasks that are involved to take out the money. But I think it's important that people have products that are useful to them, that they trust, that are places that are convenient for them, and that the fees don't end up tapping all the principal that's available. I think this idea of financial planning is one that we all struggle with. How do we become better at envisioning ourselves in the future and helping our current self plan for our future self? But most of us know there's going to be some expenditure ahead that we can't predict. And we sort of have this vague notion of it. It might be very lumpy. And it may be that we can help people with counseling and education to better think about what kinds of things could go wrong. Yes, I might have to get new tires. Yes, I might have to get a new roof. What's that going to cost? When might that happen? And start to think about that so that people are better prepared to come up with cash in a pinch when these expenditures do come along. Oftentimes financial planners will go through those exercises, but it's not as much true in the financial literacy or working with vulnerable populations to think about those kinds of unexpected, lumpy expenses that come ahead. The last thing I would say is that we need to be careful when we see alternative sources of financial liquidity that are out there and think that, well, the problem is that source exists. So I'll pick on payday lending as one example where many policymakers and advocates say, well, these loans are just unfair, so we need to get rid of them, which is certainly a policy decision that they can make, and they have to think about the costs and benefits of doing that. But it doesn't eliminate the need for people to have access to liquidity. So they're going to find some other way to get liquidity. Perhaps it's not paying bills. Perhaps it's some other source that markets come up with, or perhaps it's friends and family. But we always need to be careful about these effects and these frictions that take place when a particular product appears or disappears in the marketplace. And again, it's certainly within a policymaker's purview to think about which products are just not worthy to have on the market, but then think about, well, what's the alternative and where will people go next, and try to be thinking ahead when these kinds of policies take place, what might happen in the future. So I look forward to the discussions, comments today, and to your questions as well. So thank you very much.
Great. Thanks, Michael. And now we're going to turn it over to Pamela Chan with New America Foundation.
Thank you so much for having me in today's webinar. The implications that Michael mentioned are a perfect segue into the discussion of some of the work we're doing at New America to develop specific policy recommendations to support emergency savings. Next slide, please. I'll start with an introduction of the New America Foundation before providing some comments on the paper. Since Michael's presentation did a good job describing the need for and barriers to emergency savings, I'm not going to rehash the information presented. Instead, I'll go ahead and spend a bulk of my time talking about New America's policymaking approach and provide a catalog of policy recommendations to help leverage savings opportunities for lower-income families. Next slide, please. For those who may not have heard of us before, the New America Foundation is a nonprofit, nonpartisan public policy institute. Our primary office is in Washington, D.C., but we also have an office in Sacramento, California, and are opening a new location in New York City. Our work covers a wide breadth of issues, which I've included a sampling of on this slide. Next slide, please. Within New America, I work on the Asset Building Program. Our mission is to broaden access to economic resources through increased savings and asset ownership. To fulfill this mission, we collect, synthesize, and disseminate resources and policy ideas on a variety of related topics. This means we're constantly seeking interesting and innovative ideas from the field to present to decision makers in D.C. We're also constantly gathering research to share and scale the good work being done in communities. We promote initiatives that can improve savings opportunities over a person's life and engage members of Congress on asset building issues. While our work covers the gamut of asset building opportunities, I'm going to focus this presentation around the work we do to support emergency savings. Next, please. I'm really excited about the paper Michael just discussed. It provides a comprehensive review on the importance of emergency savings on financial stability and plays a much-needed role to direct attention to the real-time savings needs of lower-income households. Too often, discussions around personal savings and asset building focus on long-term needs such as home ownership, education, finance, and retirement, which are absolutely important but not necessarily the most pressing needs for low and moderate-income households. The big takeaway for me is the observation that the emergence of quick credit products tell us that there's an underlying need for liquidity that these markets are trying to access. While we do need to address the cost of small dollar credits so that families can get by in the immediate term, we can't forget that in the long run, we need to find ways to help families rebuild their balance sheets and increase their savings so that they will have that cushion to fall back on in hard times. Next, please. While the paper talks about why people need liquid savings, there's still a major question looming. How much is needed to work, and what's the target for policymakers? Unfortunately, there's no definite answer, but that's actually probably a good thing since different families have different needs. What we do have is evidence that suggests that even a relatively small amount of liquid savings can help to increase financial stability. The first piece of evidence comes from a 2005 survey conducted by the Consumer Federation of America. The survey found that lower-income respondents with emergency savings of $500 or more were significantly less likely than those with less than $500 to report a negative financial experience. While survey data is certainly insightful, the Urban Institute has gone even further by testing the effects of holding assets on financial instability and recently reported that among the households in the lowest income quintile, the group with liquid assets anywhere from $1 to $2,000 was significantly less likely to experience hardship than those that didn't have savings at all. The likelihood of experiencing financial hardships continues to decline with increased levels of assets and income. Next slide, please. Since Michael talked in depth about many of the barriers to building emergency savings, I'm not going to go into the first 4 points on this slide. However, I'd like to focus your attention on the last point. In addition to all the aforementioned barriers, there's also a failure of public policy to support the need for emergency savings among lower-income families. For sure, the government has and continues to support savings and asset building for Americans. In recent years, it's been about a little over $400 billion of the federal budget, and for 2012, President Obama proposed to dedicate over $500 billion. Most of the federal government support to encourage savings is through the tax code, An estimated 85% of those tax benefits go to the top quintile of taxpayers, and nearly none is dedicated to encourage emergency savings, which is the most cited savings needs among lower-income Americans. So what can we do to help break these barriers to emergency savings? From where I sit in the world at a think tank, I mostly focus on the policy barriers. However, that doesn't mean that the others get ignored. Rather, all the barriers are deeply intertwined, so we try to think about how public policy can both redirect government resources to helping those in need and to relieve some of the private market and personal barriers that exist. Next slide, please. This diagram maps out our general approach to making a savings-supporting policy landscape. We start by identifying key savings opportunities. Then we determine what interventions would be most appropriate to leverage those key opportunities, assess the role of policy to support the interventions, and finally, advocate for the implementation of the proposed policies. Doing a variety of work along the spectrum allows us to be a hub of information on nearly all issues related to emergency savings. We're currently focused on 5 key savings opportunities that have been established by research and past asset building initiatives. The 5 opportunities are tax time, the workplace, public assistance programs, financial service providers, and community-based services. I'll go through each savings opportunity individually and highlight the work we're doing along the policymaking spectrum for each. Unfortunately, I'm not able to go into details of everything in this presentation, but I'm happy to talk more about any particular piece at a later time. Next slide, please. Tax time is now a well-established savings opportunity for low and moderate income households. Due to the Earned Income Tax Credit Program, it is potentially the largest influx of cash for lower income families each year. Additionally, thanks to the proliferation of tax preparation sites, both free and not, it's a moment where a broad range of households can be captured. There have been many interventions done over the years that we've been able to document. For example, there's a long history of asset building initiatives at free tax clinics, a savings bond pilot, and a Save NYC program, which was brought into a national Save USA demonstration. Based on the evidence from these interventions, we've got 2 major policy recommendations to help leverage this tax time moment to build emergency savings. First, we have helped to create and shape the Savers Bonus Act, which is a proposal to scale the Save NYC and Save USA programs. In the Savers Bonus, households with incomes up to 120% of EITC eligibility can get dollar-for-dollar tax refunds up to $500 annually for saving in an eligible account. The savings can be made as a contribution through their tax refund or at another time during the filing year. In terms of our advocacy work in this area, the Savers Bonus Act was introduced by Congress in 2008 and is about to be reintroduced this fall. We've also had the privilege of partnering with a grassroots advocacy group called Results to build awareness of the bill. Second, we are continuing to encourage access to a variety of liquid savings products through the tax filing process. In this area, we've already had some success as a partner on the D2D Savings Bond Working Group, which made it an option to directly deposit part of one's refund to a savings bond. Additionally, we have advised and continue to work with Treasury on including a savings pocket in a pilot program that is testing the feasibility of delivering tax refunds on a reloadable prepaid card. Next slide, please. The workplace is another key savings opportunity because it's the primary source of income for most households, and there's an existing payroll system for automatic savings through direct deposit. Additionally, it's become the primary place for other savings opportunities like retirement savings, making it one of the best places to create an automatic savings system that allows people to set it and forget it. In the workplace arena, we're actually one of the groups trying to figure out what the appropriate interventions to leverage this opportunity are. One of our core projects is the AutoSave pilot. It explores the feasibility of using payroll systems and direct deposit to create an automated non-retirement savings program that is accessible to a wide range of lower-wage workers. The pilot is being done with 2 experimental phases. The first is an opt-in system where employees have to sign up for the program and open a bank account through the program if they don't already have one. We've been working on this opt-in system for almost 2 years and have 8 participating sites. The second design is an opt-out system where all employees are automatically enrolled in the savings program unless they take themselves out of it. We're very much in the research and design phases of this opt-out system, so it's not in place yet. Though we're still working on learning from the pilot, we're able to identify a couple of policy opportunities, such as having government encourage more use of direct deposit and split pay functions, and to explicitly permit employers to create automatic non-retirement savings structures for their employees, as was done for retirement savings in 2006. Outside of the AutoSave pilot, we're also investigating the possibility of adding emergency savings investments or accounts to retirement savings programs like IRAs and 401ks. It's a pretty complex area, so we're just trying to figure out whether or not there are possible emergency savings opportunities here. Though we're still very much in the early phases of research and development for workplace savings policy, we're able to share the learnings we have so far to regulators, employers, regional asset building coalitions, and financial service providers. Next slide, please. Public assistance programs are the third key savings opportunity. Public benefit programs help to capture many of the most underserved households in the U.S. It's really a promising area to encourage savings, but its effectiveness in reaching this underserved population is highly dependent on the program eligibility rules that govern access to the programs. Michael highlighted the asset limits issue earlier, and while that's absolutely a critical issue to what we're working on, I'm going to highlight some of the work we're doing to make sure there are asset building structures attached to these programs. For example, some of the work we're doing is on scaling a current federal program that provides a savings account and automatic savings structure for some public housing residents. This policy development is being done with Jeff Lubell from the Center for Housing Policy. Additionally, we're ramping up some research on ways to offer savings products through other public assistance programs, such as removing the reloading restrictions on benefits cards and adding a savings pocket. Next slide, please. The fourth opportunity is with financial service providers, which are the most mainstream place for asset building and the most likely avenue to reach the widest population. To collaborate with financial service providers, we're looking at different products with asset building potential, such as small dollar bank accounts, prepaid savings products, and financial management tools and services. Some of the policy interventions under investigation in this area include finding ways to incentivize firms to provide basic asset building services, reducing enrollment barriers, supporting marketing and promotional campaigns of accessible products, and enacting and enforcing consumer protections on these products so that they don't deteriorate what assets are held in them. To help promote these policy interventions, we provide comments on financial services issues to Treasury and the CFPB, as well as collect and share provider and consumer insights with government regulators so that their initiatives continue to promote financial inclusion. Finally, we continue to collaborate with national initiatives like Bank On and the America Saves campaign. Next slide, please. The fifth and final savings opportunity I'm going to highlight today is community-based services, such as nonprofit financial counseling centers. I'm not going to go into this area too much because May is presenting next and is a much better representative for talking about the promise of community-based programs. However, I do want to highlight that it's been very much on our radar to seek federal support for such initiatives. We're definitely interested in continuing to learn more about quality interventions and policy ideas to help scale community-based services and would really like to maintain an active conversation on the issues with interested parties. Final slide, please. The invitation to join in this conversation or information sharing goes for any of the savings opportunities, interventions, policy recommendations, or advocacy work I've discussed today. Our work at New America covers a very wide range, but couldn't be done without the excellent partnership of groups like the Center for Financial Security, the Financial Clinic, and many, many others. My contact information is provided here, so please feel free to reach out and follow up with me after this session.
Great. Thanks so much, Pam. And before I turn things over to May, I just want to remind our participants, if you do have a question you'd like to submit, please feel free to do that at any time via the media site question option. So with that, I'd like to turn things over to May Watson-Grote.
Thanks, Nicole. And how are we on time, Nicole? What should I aim for?
Go ahead with your entire presentation. We're good.
Okay. Thank you very much. And I too, appreciate being here and being able to profile the work that we do and to be a part of this conversation. Thank you. So the Financial Clinic is a 5-year-old financial development firm, nonprofit organization. We serve working poor folks, primarily in New York City, whose earnings put them in a wage gap, too rich to qualify for public benefits, but yet really too poor to be considered financially secure. Many are working and and have earnings but cannot afford basic necessities, much less plan for their future. Our mission is that of financial security. It's a combination of presenting issues which are about 2/3 of our customers come to us with debt or credit problems, and then we help transition them in a financial coaching setting to work on their financial goals. We have about 13 financial coaches working in about 24 sites across New York City with our partner organizations, and a total of 21 staff people. And we have two scaling strategies in particular. One is working with other nonprofits and public sector agencies, helping them integrate financial development strategies into the context of their own mission and service delivery model, recognizing that financial insecurity underlies workforce development, supportive housing, domestic violence, foreclosure assistance, for example. And then our second strategy is a fellowship program, which is a low-cost, high-impact model for scaling our outcomes-based financial coaching services. Next slide. So financial security is the why of what we do. It is represented by this quasi-Venn diagram that captures all of the subject matter that we cover with our customers and threaded together by financial goals. So with regard to the assets area, we're working with our customers on public benefits access, all the way through employment benefits that folks might not be taking advantage of. And our outcome there is consistent savings. Everybody who we're working with one-on-one, we are trying to have consistently saved towards a financial goal. With regard to the banking area, it's everything from getting banked to low-cost checking and savings accounts, all the way through accessing the services and products that support financial mobility. And our goal there is to lower the cost of services and products for our customers. Credit is everything from establishing through rehabilitating credit histories. Increased credit scores is our outcome. Debt, our financial coaches work with our customers to organize it, prioritize it, avoid it, get out of it. And our outcome there is improved debt-to-income ratio. And then finally, taxes. We help people access free tax preparation services all the way to year-round tax credit planning. And our outcome is our customers' ability to use a portion of that refund for a financial goal. So that's the why of what we do, and directly it captures our mission. Financial development, when we use that term, it refers to the how we go about accomplishing our mission. And so that's the combination of financial education, tax and FAFSA preparation, financial counseling and coaching, planning and advising. And then we also have a number of attorneys on staff that provide legal advice and representation around personal financial issues. Next slide. So the clinic worked with the Center for Financial Security in 2009 and 2010 to study our Money Up program, which is a United Way of New York City initiative that combines free tax preparation with year-round financial coaching. 436 customers were surveyed about their financial security, nearly a 30% response rate, and it was pretty clear that there was a pretty severe impact of the recession. And so in the last 12 months preceding the survey, respondents reported having experienced a range of financial stressors, creating financial security. Over a quarter had lost their job, and half had applied for public assistance like food stamps and Medicaid. And then dating back even before the recession, capturing our data from our inception, clinic customers are typically financially insecure. If you look at the wider opportunities for women in the School of Social Work at the University of Washington's research on the 2010 New York Self-Sufficiency Standard, when you examine a basic family budget, so that's just housing and food, transportation, child care, and health care, without public assistance, Netflix, cable, occasional pizza, or even savings, a single parent with one preschooler and a school-age child needs to earn $63,000 in Brooklyn to be able to make ends meet, which is a stark contrast to the average $17,000 our customers earn. And so they seek our financial coaches out for overwhelming debt and bad credit, indicated by the 1/4 of them that aren't able to pay their bills on time. And then turning to the topic at hand, most have little or no savings. 76% had less than $500 in savings, which is the total of the percentages here. And then most of them had zero. The remaining quarter usually have some kind of savings related, longer-term savings related to retirement. Next slide. And so we have been able to group the why this is, I think, into kind of three themes, from labor market and economy failures to situational and behavioral failures, and then to policy shortcomings, probably not too dissimilar from Michael's findings in his slides of why low-income people don't have emergency savings. And so I won't do those in detail because I think they're a pretty good parallel to the information that he's already captured. And instead, I'll turn to what our customers do then in light of these different pressures and these different factors. And for as many challenges, there are solutions. Our customers are absolutely creative problem solvers. In addition to the factors captured in Michael's chart on the liquidity mechanisms, our customers are also some of the best budgeters we know. They take on stopgap jobs or patchwork jobs. They're engaged in the underground economy. They double up on their housing. They participate in susus. They absolutely borrow from friends and family. They might also participate in bartering. I might borrow my neighbor's monthly Metro card in exchange for watching her kids this week after school. And then, of course, there's also just doing without. And people are on a pretty wide range of these coping mechanisms all the way through crises. Some of our customers experience homelessness and experience food insecurity by going without food and skip prescription drugs or other basic health care because of the lack of emergency savings. Next slide. And so the clinic's signature philosophy, one that we think lends to a higher uptake rate and our retention rates, is around helping our customers not only address their presenting issue, but also help them think about the future. The IRS notice they don't understand or collection agencies calling will definitely get them in the door and seek out our financial coaches. But what gets them to do the hard work of the budgeting and the doing without, making sacrifices, is the promise of a better future for themselves and for their children. And their future is made clear by our coaches' ability to help articulate an action-oriented, passionately held, and forward-thinking financial goal. Another way, perhaps, to put this is that the man could prompt action, but sustainable behavior change against all odds certainly comes from within. And our hope at the clinic is for policies and marketplace practices to model that process better. My contact information is also in the last slide, and I, too, welcome any additional questions or comments. Thank you.
Great. Thanks so much, May. So we're going to go ahead, and we've got about 5 or 6 minutes for Q&A. So for this one, I'll throw it out to Michael, Pam, and May, and whoever would like to jump in. Do you think that health care reforms will help prevent health costs as a need for emergency savings?
So I guess I would like to hear both Pam and May's response to this too. I think it will certainly help, but even with really good insurance, people still face costs that aren't covered. And if you have a family of 4 kids, it's pretty easy to accumulate a lot of costs just from copays and those kinds of things. So certainly it's a step in the right direction. It's just one of many costs that people face, and I think we're going to continue to have people who face these expenditure shocks from from healthcare costs, even with really good healthcare coverage.
This is Pam, and I absolutely agree with what Michael said. I think definitely, anything that can help to lower the costs that families face today certainly potentially frees up some additional funds for asset buildings. But I think that, the way that the world is set up right now, it's, the stack is kind of built up against lower-income families in terms of asset building. So, just reducing costs alone are not necessarily going to mean that they're going to be outcomes of increased savings.
Right. There are too many factors influencing what the people's overall budgets look like to have this be have it be any kind of silver bullet. It will certainly help, but there are so many other factors at work.
Okay, great. Another question that came in is, and Pam, I think this one's for you. In terms of public policy awareness, what are you doing in regards to the Earned Income Credit and Child Tax Credit awareness? Should the government have incentives in place for those who save their tax credits?
Well, that's a really great question, and I think that our Savers Bonus Act proposal definitely tries to address that. And so, right now there is no incentive for people to be saving what they receive back as part of their refund, but by providing a dollar-for-dollar match for that first $500 put into precautionary savings, that will be a way to encourage people to save their EITC and child tax credit refunds more.
And if I could add, this is May, one thing that we would love to see around the Earned Income Tax Credit is a periodic EITC or some type of reinstitution of the Advanced Earned Income Tax Credit. We think that would do an enormous amount for our customers' ability to smooth their income throughout the year and not just during the tax season. And given our focus on helping people consistently save, that could certainly help folks with emergency savings as well.
Great. This one's for the whole group. How can we get clients to be better at planning ahead and saving for a rainy day or emergency?
This is May. My take on this is that the emergency savings is really a milestone for the financial goal, that people's ability to save for that insofar as they have all of these other constraints and pressures and demands, it's much easier for folks, I think, in addition to the mechanisms that Michael outlined, much easier for folks to embrace and act upon when it's put into context of a longer-term financial goal.
Great. And one last question here. Pam, you mentioned a savings pocket in electronic bank accounts. Can you talk a little bit more about what that is?
Sure. So what that's talking about is right now with prepaid products in general, not necessarily the benefits cards that are available now, a lot of different prepaid companies are adding a component to the card that's called a savings pocket. And so the way that works is there's just another account attached to the prepaid card where general transactions can happen, and a person can treat it just the way they would like if they had a checking and a savings account. And so, they could put money into that savings pocket. It's, restricted to 6 withdrawals a month, just like savings accounts are. For the most part, they're still FDIC insured as long as the prepaid company follows the accounting standards set by the FDIC, and the consumer can just treat it as they would a savings account. It's just that it's provided through a prepaid product rather than directly at a bank.
Great. Well, with that, I'd like to thank our speakers and participants. Thank you so much, everyone, for participating today. Our webinar will be archived at cfs.wisc.edu within 1 week, and we should have the PowerPoint slides up within the next 24 hours. So please check back on the website. And our next webinar is on Tuesday, November 8th. Jonathan Spader with Apt Associates will be presenting Encouraging the Use of the Retirement Savings Contribution Credit through VITA Sites. And everyone will receive a registration email sent out to you within the next couple of weeks. Thanks so much and have a great day.